I think I'll just take a minute and talk to folks about something that most everybody is interested in, which is just trying to look good and kind of how you go about doing that as we get older. And some of us are blessed with great skin and you look good until you're 100, and others of us have to struggle for that. One of the things that I'd like to kind of just impress upon people is sort of the idea of sort of small things, multiple small things adding up to big things. And I think, a lot of times people look at cosmetic procedures, they look at creams and different kinds of things that they can do. And then, when that doesn't work, like, okay, I'm going to get a facelift or blepharoplasty or brow lift or any of these kind of things. And really, there's a lot of things that you can do prior to that, but you kind of have to be dedicated. And unfortunately, you have to spend small amounts of money, over a longer period of time to kind of reach those results. The end result, and what everybody likes to try to talk about, is how to make your skin put more collagen and elastin and fibrin and all that kind of stuff. In theory, that would be great. That's not really what happens. Cosmetic procedures in general is the management of placing fibrous tissue. And some of that, there's collagen in there, there's fibrin, there's elastin, but for the most part, it's effectively placing scar tissue in the appropriate layers. And so chemical peels are effective, usually not the shallow ones. It has to be something kind of back to the, if it's no pain, no gain kind of thing. If you're just doing little sandblasting of the skin, or you're doing very shallow depth chemical peels, you can't expect to get much of a benefit out of it. It needs to kind of hurt, it needs to be raw. You need to have a peel, almost like you're having a bad sunburn. So that can be done with chemical peels, and there's all different kinds of TCA peels, glycolic acid peels, phenol peels, VIP peels, which are ones that we have available, but also things like skin pin. And the skin pin is basically, it's almost like a tattoo needle, but instead of having just a few needles on it, this thing's got 20 or 30, and it just vibrates and pushes the needles in a millimeter or so into the skin, and it's uncomfortable, but most people can tolerate it. We can apply some numbing medicine, and it's a relatively inexpensive way to go about doing things, and it definitely provides access into the deeper layers of the skin. So by that I mean, by poking into the skin, it's actually going to create fibrous tissue there, but it also allows you to do other applications. And one of the things that I like to do is apply retinoic acid to the area during these events, and that can kind of add to the efficacy of it. But so I guess what I'm advocating today is to pay attention to these smaller interventions that people can do. And there's a million med spas around. Look it up and try to develop some kind of a comprehensive skincare plan that starts early. And even if you're behind the 8 ball, or you're getting older and you're to the point where you need surgical intervention, there's still some things that you can do fine tuning to limit how aggressive the surgical intervention has to be. For example, a lot of people have lower lid eye problems like I do, and you can tighten up that skin using these sort of non-aggressive techniques, and you can do that before moving forward with a more aggressive type of a facelift or one of those kind of things. So anyway, this is something that we do here. There's a lot of people that do it. This is really not necessarily to have people come see me about it, but just more of an education, a blog type thing, and just to fill people with knowledge. If you need us, we're here.